Welcome to Disability Maternity Care. Today we're going to be talking with Molly Irvine about her experiences of parenting.
Hello.
Molly, how are you going?
I'm good, thank you. How are you?
Yeah, very well. I'm Namira, and part of our briefing is gathering stories from women who have a disability and talking about what their journey's been like as parents. And so I think, the more that women know what it's like for other women, the better it is, the more it can actually enable.
Yeah, definitely.
Yeah. And start with Molly, can you tell us a little bit about your disability and what it means in everyday life for you?
I was diagnosed with transverse myelitis in 2007. Only 14 years at the time, and I lost all movement from about my hips down. From there, within 2 years, I gained quite a lot of movement back, but I can walk, but I'm a lot faster, to be honest. So, it ended up being my primary mode of transport.
Yeah.
Every day, it's been 14 years, so it's kind of my new normal, I guess, anyways. I do, have a modified car, and all of my house has pretty much been modified to cater to somebody at my height and everything like that. So, where I work on a spinal injuries unit, so they're very supportive of all the ergonomic needs that I need.
Yeah. You've got first-hand access then.
Exactly, yeah.
Yeah. And so when you decided to become pregnant, were there any particular worries that you had around your disability and pregnancy or the birth at the beginning, at the beginning of pregnancy?
Yeah, I definitely had worry about even just about a pregnant to begin with. I saw a GP and talked to the spinal cord to discuss fertility options if it was going to be a struggle. And the kind of reply I got was, "You're going to have to just try it and see how it goes," kind of thing. And surprisingly, within a month of getting off of birth control, I got pregnant. It was a very quick process. And yeah, there was absolutely no issues. I was quite lucky, I guess, in that sense that my reproductive organs were never affected at all. But yeah, and from there, I think I definitely got monitored through my pregnancy a lot closer, I think, than would, especially right at the beginning. I had quite a lot of doctors who were, I guess, from where I work, I guess I had a lot of doctors that I could kind of fall back on, because, I would talk to them on my day-to-day basis anyways. So, they definitely monitored me very, very closely.
Yeah. So it must have been quite a relief that it didn't take you too long to actually fall pregnant.
Yeah, definitely. I was quite surprised, because it was kind of it might take up to 3 to 6 months to be, and yeah, it was quite a shock.
Yeah.
But a happy shock.
Yeah. And during your pregnancy, did you find anything in particular a challenge?
Yeah, I think for me, my blood pressure would be quite high my whole pregnancy. That thing I think we struggled with quite a bit. And it was determining. Yeah.
Sorry, I was going to say, was that a result of the transverse myelitis, or was that just
I think
kind of pregnancy hypertension?
It was quite difficult to kind of differentiate between the two, I think. It was kind of, is pregnancy related, or is it to do with, I self-catheter, and sometimes if I don't do that, in a decent amount of time, that can shoot my blood pressure up quite quickly. You would be going through steps to go, okay, make sure I've done a catheter, make sure I've had some water and some food, and make sure I'm in a cool environment, and just see if it would drop. And majority of the time it would. there was a little bit towards the end of the pregnancy, I think at 37 weeks, that it just wouldn't drop. And so I was monitored patient for about 4 hours. And from there, I think they did a urine test and realized it was just at that level of pre-clear. And so that's when an induction was decided from there. But other than that, I think the only difficulty I had with my pregnancy was just mobility. Once I hit kind of third trimester, I really, really struggled to get around, resulting in me having to stop working a month earlier than I would have preferred. And I think I was mainly bedbound for the last 2-3 weeks. And so that was definitely my biggest struggle, because I'm such an independent person, as it is, just, having other people do things for me because I couldn't was a bit of a mental hurdle I had to go through. But other than that, it was a pretty pregnancy, I suppose. It went very, very smoothly right at the beginning.
Yeah. And you mentioned that you self-catheterized. So did that create more, did you have more urinary tract infections as a result of that? Do you think? During pregnancy,
I think
when you're more
I ended
prone
up,
to
infections
anyway?
I think I ended up having 2 through the pregnancy, one quite early at the beginning, and then I think towards the end of the second trimester I had another one. There was discussions of putting me on like a low dosage of antibiotics just to keep them away, but every time I had one, they put me on a 3-day dose of antibiotics, and quickly. But yeah, it was doing daily urine tests just to double check how it was going. They really wanted to make sure that it wasn't getting worse. Quite like there, and I was trying to really, I do this anyways, but I really kept up with my hand hygiene when I was doing my catheters, and making sure I was being as clean as possible to avoid any you guys.
Yeah. And you said that you had an induction with Cameron's birth. Yeah.
Yes.
So can you tell us a little bit about how that was for you? How pregnant were you at the time that you had the induction?
So I think I had just hit 39 weeks at the time.
Sorry, how many weeks?
And 39.
39. Yeah. So
so I was almost there.
Yeah.
And it was just that little bit of protein in the urine, and they were just a little bit concerned that they didn't really want me to go home and things kind of take a turn for the worse. And so I think the night before they tried to do the catheter that has the balloon that would go into the cervix, and then they did that the night prior to try and get things going, but that didn't really do anything. And so they started the medication at about, I think, 8 a.m. And from there, everything actually went quite smoothly from there. The whole birth itself, I think, was about 16 hours. And they did have to adjust the medication because it was kind of progressing a bit too quick at one point. So they had to pull that back again. And, and then I think at about, at 14 hours, they realized that Cameron was, he was down in a good position, facing, towards the sky and not towards my spine.
Yeah.
And they were a bit concerned about that. So it was the midwife had to try and, turn around, see if we could get him in a good position. And when that didn't work, it was, okay, let's get the doctors in at this stage to see if they can have a go at it. And they tried. We got to a point where they thought they had turned him around. So it was, all right, let's get this going. I was able to push we kind of did it in a staggered way because I was worried about fatigue with pushing. Mm-hmm. And so they did, it was a few pushes and then a rest, and then a few pushes and then a rest until we were able to get to that stage that they could help with the forceps. That's how he ended up being born, through that way. He actually didn't turn around. He was born facing up.
Yeah.
Which was, they tried their actually think that he had turned around, but he was sneaky and he stayed upright. But yeah, so he ended up being born with forceps, and they had to put on me as well, just to get the room for the forceps to go in.
Yeah. So during your labour as well, obviously with the transverse myelitis, it limited your ability to sort of move around in labour. Do you think that made a difference for you and increased the length
think
of
so.
labour, perhaps?
Yeah, I think so. There was a few times that the midwife was kind of stuck on what to do when things weren't progressing, because she would say, usually we'd get somebody up and get them back and forth and move their hips and, do stuff like that, which is just something I couldn't handle. I did they got me to try and like switch positions a little bit, to sit up and see if I can rock my hips back and forth just in bed. And I do think that lengthened the time quite significantly. We did have a discussion afterwards, is like, I wonder if me being in my sitting position had a factor in which way he was facing, and that he couldn't get into the position for birth they wanted him. Luckily it turned out fine anyways, but it was interesting to see that, that might have had a difference.
For you. Yeah, that's right. So maybe going back just a step, Molly, thinking about sort of in your pregnancy, in the second part of your pregnancy, did you have a lot of discussion around the sort of preparation for the birth and some sort of strategies to put in place, or how did that work for you?
Originally, I was just seeing the doctors, and they were quite adamant that they wanted me to have a C-section. I was hesitant, mainly just because, wound care and, the time it would take to heal, I thought would be quite difficult for me. And that's when I got it's called Northern Midwifery. I got them in it. And they were very, very, very keen to be advocates of, let's try a natural birth. So the kind of plan we had was we'd go in with the hope of birth work. And then it was, if there was any complications that they thought we weren't going to be able to fix, it would go straight into a C-section. But that didn't end up having to happen. But yeah, that was the kind of plan that was in place.
Yeah. Did you have the opportunity to have a midwife follow you through, like with continuity, or did you have a variety of midwives that provided care for you during the pregnancy?
I had a variety up until about 32 weeks. That's when they allocated 2 specific midwives to me from there on, which I was very happy to have.
Yeah, so is that something that happens for all women, or was that something that a strategy that was decided that would actually benefit you the most?
For the hospital, I have a referral program for anybody, but whether or not they'd accept, I think it was like the most serious cases, or the people who needed a little extra help, whether you got accepted to it. So it's definitely on offer for anybody, but yeah, whether or not they'll accept you as a patient is the other question. But yeah, I got fast through just because of my high risk status.
So women are more likely to be able to access that continuity from 32 weeks on, when they have specific issues, or it's a more complex pregnancy.
Yeah, definitely. Yep.
Yeah, oh, that's a different model of care, which is great. Yeah. And thinking about pregnancy again, when you were getting your house ready for your baby's birth,
yep.
for Cameron's birth, what sort of specific changes did you need to think about in preparation for bringing him home from hospital?
Yeah, that was a tough one, because we, being first-time parents, we were like, oh, we have no idea how it's going to go. We spent a lot of time looking for things that were height adjustable.
Yeah.
Specifically, a change table that you can drop down and use as a desk for the kid when they're older, but that desk height ends up being a perfect height for me as a change table.
Yeah.
So, stuff worked out very well. In terms of his cot in his bedroom, that was a bit of a struggle to figure out what to do there. I couldn't, lift over the side of the cot. And so my partner, who's an engineer, ended up getting a cot and altering it to have open door and locks and safety measures and stuff on it to that I could just swing it open and put him in and then close it back up. But in terms of commercial stuff that you can buy, there was absolutely nothing out there for a person in a chair. It was everything I looked up and everything I found was made or they was at home or something, which was quite, I wasn't expecting to find much to buy for people in chairs with newborns, but I thought there would at least be a few things there. Everything we did buy was either just circumstance and it was like, yep, this was made for a different purpose, but it works for me, or yeah, we had to alter it.
Yeah, well, you're very lucky your partner's an engineer then.
Yeah, very lucky. And we've already had a few people ask if he can do their cots as well. So, it might end up being a good business for us one day.
Yeah, that's right, definitely. And were there any other changes that you needed to make to your house? I mean, you mentioned at the beginning that, with your house, you've got sort of you've adjusted the bench heights and other things too. Was there anything else you needed? What about in terms of baby bathing? How did you manage around
so that one we tried to figure it out and we kind of struggled. I tried to do it with just the kind of like pop-up baths that you can take anywhere, but I struggled with only getting water in and moving it around, but picking Cameron up while he was slippery was also quite tough for me. So it just became a decision quite early on that it would be my partner who would do all the bathing, and I just help by trying to set up the bath ready to go, finish, I'll get it dressed as well. But yeah, that one definitely being my partner.
Yeah.
Which was, I guess, in a way, it was upsetting, I guess, because you always want to be able to at least try your kid. But I understood that there was just some things I probably wouldn't be able to do safely. So.
Yeah. Do you think if you had access to like a height adjustable bath, that might have been helpful?
Well, we did. I had a friend who is also in a chair, and her daughter is about 3 years old now, and she let me borrow. It was kind of like a bath stand that comes with a bath on top, and even that I struggled with. I think it was just that the combination of water and a very square baby just didn't work well with me. So it definitely, yeah. I think, if I kept up with it, I probably could have found my rhythm to try and figure it out. But it ended up being quite against my parents' son. So I kind of took a step back and just let them do it.
And it's probably good bonding time too, isn't it?
Yeah, definitely. I think that made a massive difference between how my partner felt about our son and how, it was a really nice thing to watch. So I enjoyed being able to sit back and just enjoy watching.
Yeah. Are there any other challenges that you think were quite difficult, either during your pregnancy or the birth or sort of early mothering days at home that you'd like to share with us? And maybe strategies that you use to overcome those challenges?
I think one thing I think I realized quite early on was to, ask for help was a big one. Like I said, I've always been quite independent. I've been really reluctant to ask for help. But I did have to kind of, get my mum to come over to help me with some things, or, my partner to come home early from work. Definitely towards the end of pregnancy, even just to help me get dressed and shower and stuff was quite difficult. So, my partner and mum had to kind of come in as carer for a little while. It was difficult for me. With the birth, I think being able to have those midwives who were there with me through the 32 weeks onwards, a massive difference to, just have them advocating to the doctors for me, because I didn't think the doctors were really understanding why I wanted to go for the natural birth. And I was having a hard time kind of explaining myself to them. So I think having them there as backup was amazing. And then after the birth, I think I because it was during COVID, they didn't have any mums groups happening, or there wasn't any, I think we had the midwives come after the birth, and they didn't have enough staff to keep coming out after that. So we were kind of left to our own devices after 2 weeks. And I definitely Australian mums on Facebook, and that was quite nice. We're all kind of in the same boat with the same age kids, and parents, or oh, this is what my nurse said to me, it might help for somebody else, and that was really, really beneficial for me.
Great. Yeah, I think that's crucial, isn't it?
Yeah, and I would have loved to be able to go to some mums groups. It was unfortunate that it was around that time that just wasn't able to happen, but yeah, it's not too bad. Internet was still good. I'm glad we had the internet ready to, I was Googling so many things.
Yeah, as you do. Yeah. So thinking back, is there any other advice that you might give for other wheelchair users as mums, in terms of thinking about pregnancy, birthing and early parenting?
Yeah, I think definitely just kind of keeping in contact with the doctors and making sure you're getting those scans and getting everything, organized. Even before I got pregnant, I was double checking all my medications were safe for pregnancy. I was taking, so I kind of did a withdrawal from that before I got pregnant as well. So I definitely had a good handle on preparing to be pregnant. Other than that, there was one thing that I think is going to stick with me for the rest of my life, which was, I think, a week after I gave birth, we had one of the midwives out, and I was stressed. My partner could settle my son, absolutely no problem. I just could not, he would just cry and cry and cry when he was with me. And I kind of said, what am I doing? And she kind of said to me, you've got to be prepared that because you can't stand and rock back and forth and rock your hips and stuff, you might not be able to settle him as well. At first I thought, oh, okay, that's okay, that's fine. And then the more I thought about it was, oh, but, he's been in my belly for 9 months and I'm rolling around, I rock back and forth in my chair just because I've got anxiety issues. So I'm like, he's used to that feeling. And the more I thought about it, the more I calmed down, and I, the way I was holding, changed the way I rocked my chair, and just spent a lot of time kind of concentrating on what settles him and what doesn't. And I got this stage where he then preferred my settle down. And it was just, I realized it's persistence, just trying not to because her words really got to me quite badly. And I'm thinking,
understandably, of course.
Yeah, and I know she came from a good place, but I think somebody who's just given birth a week prior, it probably wasn't the smartest thing to say to me. When
you're feeling very emotionally vulnerable. Yeah,
and I can understand her the way she said it is backed by science. They do like the rocking motion. I just had to figure it out in another way. So I definitely think it was definitely. And I think it probably, went in with my thoughts ever since I've been in a job of, you need to prove yourself, or you're not good enough, or, and so that's something that I hadn't thought of for a very, very long time, because I've been so independent for years. And so it kind of put me level 1 all over again, and I had to build myself back up again. And so I think, definitely persistence, and just, handing Cameron off to somebody I needed that week and need to gather my thoughts and start all over again was a massive difference in how I dealt with things. So I think, yeah, and even mental health services at the time, a lot of them were closed down. So there was, a 6-week wait to get into any kind of mental health service. So, it was definitely for me to fend for myself, which was difficult, but yeah.
Yeah.
I got through it in the end.
And you've got a beautiful baby who's soon going to be 1 as well.
Yes.
Probably seems hard to believe.
Oh, it does. Yeah. I'm surprised how far we've come. It's been a really long journey, and going back to work full time has been just tiring. But nice to see that Cameron can go to childcare and he's such a social baby. He's lovely.
He always looks so happy on your photos that you post.
Yeah, everybody says he's very expressive. He's got his dad's big bushy eyebrows. I think that makes a difference.
Just what a baby needs.
Yeah.
Yeah. I'm just a bit mindful of time. So is there anything that you'd like to say in terms of what you think health providers, so either doctors or midwives or other health professionals, should know in terms of working with women in wheelchairs and becoming mums?
Yeah, I think specifically for doctors, I would really, really enjoy them to, not cesarean, as the first point of call, considering, low blood flow and pressure injury and all the wound care is just that little bit harder for us in wheelchairs. And, the same with bed rest, a pressure sore can turn up within a couple of hours, so that's something definitely I hope they could be mindful of. And I don't think that my doctors were mindful of right at the beginning. Other than that, I think midwives, I had no, other than that one comment, they were so supportive. So I had no problems other than that. Just being able to either advocate for yourself and have to advocate for you is massive.
Yeah. Well, that's fabulous, Molly. We'll finish up in a minute. Is there anything else that you would like to add before we finish?
No, not that I can think of. But at the end of the day for me, my brain is, I need a coffee, I think.
Okay. Well, thank you so much for giving your time to Disability Maternity Care to talk about.
No worries. Thank you so much.
Thank you so much, Molly. Bye-bye.
Bye.